Welcome back to my channel, Learn with Professor Janula. If you're new here, don't forget to subscribe and hit the bell icon for notifications. In today's video, we're going to learn about care plan of mother who is in first stage of labor. Let's get started. The first stage of labor begins with the onset of true labor pains and ends with full cervical dilatation. During this stage, effective nursing care is essential to ensure the comfort, safety, and well-being of both the mother and the fetus. A systematic nursing care plan helps in early identification of maternal and fetal needs, pain management, emotional support, and prevention of complications. This care plan is prepared according to the INC syllabus and is suitable for B.Sc Nursing and GNM students. The first nursing diagnosis is acute pain related to uterine contractions and cervical dilatation. This nursing care plan explains how nurses manage pain during the first stage of labor in a simple and systematic way. During this stage, the woman experiences abdominal and back pain due to uterine contractions and cervical dilatation. Assessment includes subjective data, such as the woman's complaint of pain, and objective data, like restlessness and facial grimacing. Based on this, the nursing diagnosis is identified as acute pain related to uterine contractions and cervical dilatation. The main goal of care is to reduce the woman's pain and help her relax and cope with labor. Nursing interventions include regularly assessing the intensity and duration of pain, encouraging deep breathing and relaxation techniques, helping the woman change positions frequently, providing back massage or warm compresses, and maintaining a calm and supportive environment. Evaluation is done by observing whether the pain has become manageable and whether the woman is coping effectively with the labor process. The second nursing diagnosis is anxiety related to an unfamiliar labor process. During the first stage of labor, the woman may feel fearful and anxious because she does not know what to expect. Subjectively, she may express fear and anxiety, and objectively, the nurse may observe restlessness and an increased heart rate. Based on these findings, anxiety is identified as the main problem. The goal of nursing care is to reduce the woman's anxiety and help her remain calm. Nursing interventions include explaining the labor process and its progress in a clear and simple manner, encouraging the presence of a support person, allowing the woman to express her fears and concerns, providing continuous reassurance and emotional support, and maintaining privacy and comfort. Evaluation is done by observing whether the woman appears calm, relaxed, and cooperative during labor. Part page. End part. Page. End part. End part. Page. End part. Page. End part. 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 Part. End part. End part. Part. End part. End part. Page. End part. Part. End part. Page. End part. 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 Page. End part. 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 End part. Part. End part. Page. End part. End part. Cage. End part. 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 End part. Part. End part. End part. End part. End part. Part. End part. 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 End part. End part. Part. End 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 part. The third nursing diagnosis is risk for fetal distress related to uterine contractions. During the first stage of labor, strong or frequent uterine contractions can affect the baby's oxygen supply, which may lead to fetal distress. In this condition, there is usually no subjective data because the fetus cannot express symptoms. But objectively, the nurse may observe changes, such as variable fetal heart rate and labor progress. Based on these findings, the baby is considered at risk for fetal distress. The main goal of nursing care is to maintain the fetal heart rate within the normal range of 110 to 160 beats per minute. Nursing interventions include regularly monitoring the fetal heart rate, encouraging the mother to lie in the left lateral position to improve blood flow to the fetus, observing the color of the amniotic fluid for any abnormalities, avoiding the supine position, and reporting any abnormal findings immediately. Evaluation is done by ensuring that the fetal heart rate remains within normal limits, indicating that the fetus is stable. The fourth nursing diagnosis is risk for maternal fatigue related to prolonged labor. During the first stage of labor, the woman may feel tired because of continuous uterine contractions and a long duration of labor. Subjectively, she may complain of tiredness, and objectively, the nurse may observe weakness and signs of prolonged labor. These findings indicate that the woman is at risk of becoming exhausted. The main goal of nursing care is to maintain adequate maternal energy so that the woman can actively participate in labor. Nursing interventions include encouraging the woman to rest between contractions, assisting her with proper breathing techniques to conserve energy, providing oral fluids if allowed to prevent dehydration, reducing unnecessary physical activity, and offering emotional support to motivate and reassure her. Evaluation is done by observing that the woman remains active, cooperative, and able to cope with labor without excessive exhaustion. The fifth nursing diagnosis is risk for infection related to repeated vaginal examinations and rupture of membranes. During the first stage of labor, the risk of infection increases when the membranes are ruptured and when frequent vaginal examinations are performed. In this situation, there is usually no subjective data reported by the woman, but objective data include repeated vaginal examinations and ruptured membranes. Based on these findings, the woman is considered at risk for maternal and fetal infection. The main goal of nursing care is to prevent infection in both the mother and the fetus. Nursing interventions include maintaining strict aseptic technique during all procedures, limiting the number of vaginal examinations, regularly monitoring the maternal temperature, observing for any foul-smelling vaginal discharge, and maintaining proper perineal hygiene. Evaluation is done by confirming that there are no signs of infection observed in the mother or the fetus. Thank you for watching this session on the nursing care plan for the first stage of labor. I hope this explanation helped you understand the nursing diagnoses, goals, interventions, and evaluation in a clear and simple way. If you found this useful, please like, comment, share, and subscribe for more easy nursing notes and explanations.